My name is Inga Jordan. I'm the nurse today for Jeffrey Smith, who's a 17-year-old Caucasian boy who's driven to the emergency room last night after he collapsed at a party. And after examining the patient and talking to others that were at the party, the physician who was over his care suspected that Mr. Smith had overdosed on oxycodone. Taking that into consideration, and based on the doses prescribed, the physician suspects that Jeffrey may be opiate dependent. Therefore, an initial dose of 0.2 of a milliliter per dose every 2 minutes of Narcan was prescribed. The initial informed consent was given by his mother due to the fact that Jeffrey, a minor, and still dependent and unresponsive, was not able to participate in his care. And so even though he is a dependent, Jeffrey is 17, today what I'm going to do is go and give him information on the care that he received last night when he came to the emergency department. Hello.
Hey.
Hi, Jeffrey. My name is Inga. I just want to make sure that I have the right person. So, can you tell me your name and date of birth?
My name is Jeffrey Smith.
Okay. And your date of birth?
2006, May 10, 2006.
May 10, 2004. Okay. Okay, thank you. So, Jeffrey, again, my name is Inga. I'm here to talk to you about why you're here in the hospital. Okay. Do you remember coming to the hospital last night?
I don't exactly remember, but my friends just brought here.
Yeah.
I heard.
Yeah, you came to the hospital, you were unresponsive, and you weren't breathing well last night. So we had to do some assessments to try to figure out what was going on with you. Okay? You were at a party. It looks like we talked to several people, and the physician determined that maybe you had, it was pretty clear that you've been taking oxycodone, a painkiller. Is that correct?
Yes.
So you admit to that. And so what he did was prescribe a medication called Narcan. Okay, Narcan is can I have your attention? I really want you to understand what's happening with you, because this is a serious matter for you. And you have a lot of people who are really concerned about you. So I want to try to give you the best information possible.
Okay.
So if you just give me a little bit of your time, I'll make this very clear and as quick as possible. And I want to make sure you understand what we're trying to do for your care. Okay, hon?
Okay.
All right. So what's happening is that the doctor, realizing that you had overdosed on oxycodone, prescribed a very specific medication. And this medication was called Narcan. Okay?
Okay.
Our Narcan is an antidote for the use of oxycodone. And it only works if there is an opiate oxycodone, I apologize. Oxycodone is an opiate. It only works if that particular painkiller or some painkillers or opiates are in the system. And it certainly was in your system. Okay? So does that make sense to you?
Okay.
Yeah. So your mom gave us the consent to go ahead and work with you. You took it, the oxycodone, and we gave it to you every 2 minutes. Some of the side effects, unfortunately, is that it reverses what the oxycodone does. The oxycodone took you to a very low state wherein you weren't breathing well. Yeah, you weren't breathing well, you weren't responsive. The Narcan has the opposite effect. And some of the side effects of that Narcan is it takes your heart going up really, really fast, and you can have some irregular movements in your heart. You understand that? Tell me what your understanding of what happened.
Oh, he told me last night that I took more oxycodone, and then when I go to the party, I talked to the people around me, and then that means I took it's over.
Yep, overdosed.
So I didn't know, I was not responsive. So my friend is bring up.
And they brought you to the hospital.
Mm-hmm.
Do you understand what the medication is that we gave you last night?
That's give me Narcan.
Yeah, Narcan.
Mm-hmm.
What does Narcan do for you?
That's going to be, it's bring back as
Bring you back.
to normal. They're gonna rid of that.
So this is
Oxycodone is
yeah.
side effect in my system, in my body. You said.
Correct. I cut you off, but you did say, please repeat. What is your understanding of what the Narcan does?
Narcan does just the adverse of
the medication you were taking last night.
Oxycodones, yes.
Yeah. So that was administered stat. It was administered via IV because you were unresponsive. There was no way that we could get it down your throat or you could swallow or anything because of the state of mind you're in. So, but it works in the body only for about 30 to 60 minutes, which is why the doctor gave you repeated doses. On that third dose, one of the side effects is it causes you to vomit. And it wears off really quickly, but in that third dose, you begin to vomit. So we had to get you cleaned, make sure you were safe, making sure that it wasn't going down the wrong tube, cleaned you up, and then we stabilized you. So it's a really rapid reversal of the overdose. And it does so by blocking the effects of that oxycodone that you were taking, that pain meds. Does that make sense?
Yes.
Okay, what did you understand about that?
Oh, you told me just that the Narcan it's gonna be adverse effect of the oxycodone, and that's gonna be give me an IV. It's gonna be put on the fast too.
That is what happened. Well, listen, I want to tell you that we need to keep you here in the hospital maybe just one other day or so, because we want to monitor and make sure that you're stabilized for the next day or so. Okay.
How long I'm gonna be here?
Yeah, one more day, just 24 more hours. It was a pretty heavy dose. You not only were you taking the pain meds, you also had quite a bit of alcohol in your system.
Now, do you have a tablet form? Can I take it home if I can?
What we're gonna do, and what we've talked to your parents, and you guys will kind of work on that together, is we're gonna look at maybe having you do some counseling and looking at a center that will help you make better decisions for your life as far as the use of drugs such as oxycodone. Sometimes, and they will be the ones that will help determine what sort of medications you'll need and what sort of services you need in the future. Now, I know you may not want to read that right now, Jeffrey. I've also given it to your parents, and making sure that in the future you can make good decisions for your life, okay?
Okay.
Get cut.